going to explain to you trach suctioning. And so we've got our mannequin here, and we're going to get our sterile water. And if it's already been opened, we'll open it again and lay the top heads up on the table. And then the spout right here, so we'll know which side we've poured over. We'll pour a little bit in the sink just to cleanse the spout. Now you don't do this over medication over the label because you don't want to distort the instructions, but I just wanted to see which side I poured over. So I'm going to set this down, and I'm going to open up my suction kit. And if you're doing suction and cleaning together, always do your suction first because they may have a lot of mucus that comes out, and then you'd need to clean it anyway. So do your suction and then your cleaning. So I'm going to take this out, and remember the inside of this is sterile. So this is my sterile field right here. Now in real life with a real patient, it's best not to use the patient as a platform for your stuff, so you probably need to put it maybe on the bedside table. So we'll do that. Okay, the next thing I'm going to do is I'm going to take my dominant glove and put it on sterilely. So I'm going to take the cup and have my hand pointed up. And then I'm going to take my non-dominant hand and hold this water here. I'll take my cup and open it up like this and pour it over the sink. And see how I put a little distance between the bottle and the holder, just so I don't contaminate it. And then I'll set this down, and I can set this right back on the sterile field because it's not contaminated. Now I'm going to take my non-dominant glove and hold it under the cuff, and I'll put it on. Now it's ready to go. So I'm going to take out my suction tube. I'll wrap it in my dominant hand so it doesn't get contaminated, and I'm going to leave this sticking out right here because this attaches to the suction machine. So I'll find my tube right here, attach it, and you can see right now this over this way is dirty, non-sterile, and this way is sterile, so I can't touch this side again with this hand. So I'm going to pull this out, and I can also use my thumb right here to hold on to this when I need to. So I'm going to turn this on. I'm going to check my tubing right here, so put your thumb over the suction to check it, and yes, it's working. And then I'm going to take it and put it right down the trach area, and you want to put it down until you meet resistance. Once you've met resistance, you're going to do some intermittent suctioning as you come out. So pull out with your top hand. Let's go down and look at your bottom hand. The bottom hand stays close to the entrance of the trach, and you kind of twist the bottom hand as you pull it out, leaving it close to the trach side, and pull back with the top hand. Now at this point you want to rinse that out, so let's rinse it and clear the line. So remember again, you're going to go down until you meet resistance. You don't want the suction on at this time. Once you get down, you'll suction intermittently, pull back with your top hand, leave your bottom hand next to the trach opening and twist, and keep it tight. Don't let it loose like this. Keep it kind of tight and up like this for suctioning. A couple things to remember is the suctioning many times will elicit a cough response, and if you have your face over the opening here, a lot of times the mucus will come out of this area, so you don't want to get it all over yourself. So make sure that you keep that in mind too. This up here is your non-sterile side, and this is your sterile side. And one thing I wanted to show you, on this little tube here, there's an opening right there at the end and an opening right here. So the reason we twist back and forth is to maybe if there's any secretions, it can kind of get in those openings there. that's your trach suction, and it's very easy to do. You keep it down for maybe 10 seconds and do it maybe 3 to 4 times on a patient. Keep an eye on their O2 saturation to make sure that you're not taking too much oxygen from them. Okay, that's your trach suction.
See if you can answer these questions.